Welcome back. There's some federal changes coming to Medicaid. Nearly 79 million Americans rely on it. And there's a nationwide pause right now on some certain provider enrollments. There's also new state requirements for some states in order for participants to enroll here. That change creating some uncertainty for patients and healthcare workers and those state budgets as we all navigate this. So let's get into an interview with someone who knows a lot about it and can help us navigate it. That is Miss Katherine Hempstead, Dr. Hempstead with the Robert Wood Johnson Foundation, joining us to talk about this. Dr. Hempstead, thank you so much for being on with us today.
Sure. Thank you very much for having me.
And I want to start off for those who are not familiar with everything that's going down. In a couple of sentences, can you break down for us what are these new directives from the federal government involving Medicaid?
Sure. The One Big Beautiful Bill Act, which was passed last July, made some really important changes to the Medicaid program. And some of them had to do with federal funding and the way the federal government matched state payments, which basically resulted in a big funding cut to states through the Medicaid program, which makes it harder for them to pay hospitals and doctors. The other big part of it was the imposition of work requirements, which only apply to the expansion population. So this only applies to states that expanded Medicaid eligibility under the ACA, but requires those enrollees to comply with new federal work requirements or qualify for an exemption or exclusion, or else run the risk of losing their Medicaid coverage.
Now, some supporters of the efforts, they say that this is needed to prevent fraud, to make sure that people aren't just taking advantage of the system, to make sure that this system is put in place to help people get back on their feet and not depend on this. What is your, I guess, message to those who see this as a benefit?
I think this is a little bit of a bait and switch. I think the big cuts under the One Big Beautiful Bill Act were really largely done to help finance some tax cuts that the administration wanted to preserve and to have the ability to do that from a budgetary perspective. The decision was made to cut the Medicaid program in a historic way, an unprecedented amount of federal funding cut and the imposition of these work requirements. And then I think the issue of fraud, which is obviously an important issue, and there's fraud in all kinds of insurance programs, public and private, and fraud is not a new idea and it's not being discovered by this administration, but I think it is being raised repeatedly in an attempt to maybe make people confuse this funding cut with some kind of a fraud reduction effort so that perhaps people don't feel like the consequences are as significant as they are. So I do think there's no structural relationship between the funding cuts and the fraud, but I think the fraud is being sort of used to create a narrative that tries to sell the funding cuts politically.
Yeah, yeah. Thank you so much for breaking that down for us and getting your insight. My question for you and for those who are listening, this is a new reality for a lot of people. So if they, and I know every state will be different, but let's say here in Georgia, there will be, I do believe, some requirements. And could you explain that for us too, exactly what the rules would be here in Georgia? And now if somebody, what could, let's say somebody who is used to going to the doctor 3 or 4 times a week, what could change for them?
Well, someone that loses their coverage is going to lose their ability to access health care, except in a sort of uncompensated care kind of context where maybe they show up at an emergency room and really need care and are not able to pay for it, or they go to a free clinic, which is something that the supply is quite limited. So for people that lose their coverage, they'll lose access to doctor's visits, as you mentioned. They'll also lose their ability to maintain their health through medications that so many people take, whether it's statins or blood pressure medications or psychiatric meds or things that people need to just sort of live their normal, healthiest life. People are going to lose that access. And they're also not going to be able to follow up on new problems. If they notice symptoms, notice a funny way they feel or a lump or something, they're going to be afraid to go seek care because they're not going to be able to pay for it. So We know that when people gain coverage, we see a reduction in serious illness and death. And unfortunately, then we also know that when people lose coverage, we're going to see the same kind of pattern in reverse. There's additionally a big economic hit because people will find themselves often in debt. A lot of people have medical debt anyway, but it's much worse among the uninsured, and people will struggle to pay other bills. So there's a whole cascade of health and economic consequences that happen when people lose coverage, which is why these changes are so troubling.
Do you know right now the policy is as it stands? What is being done to try and help some of those who will see themselves without coverage? I know that there's been a lot of talk in Congress, obviously at the federal level, but is there anything being done right now to help these patients?
Well, I mean, there are many people that are very opposed to these policy changes. So I think there are a lot of people that would like to reverse them. But that's not feasible right now. I think, unfortunately, there isn't a lot that can be done, which is, why this policy has been so consequential. There are certainly, there's the charitable sector, and there are free clinics, and some free medication dispensary organizations, and there are a few things like that, but it's nothing like what's sufficient to address the coverage loss. I mean, just for a little bit of context, the estimate is that between 5 and 10 million people will lose their coverage nationally because of work requirements. Another 5 million are projected to lose their coverage because of the changes that are going on in the Affordable Care Act. So that's up to 15 million people losing their coverage. And, we started with about 27 million people uninsured. So that is a massive potential increase in the size of the uninsured population. So if you think about the progress we've been making over the last decade or so to reduce uninsurance, you should view this as a very sharp U turn.
And my question to you, for those, some people will say, okay, if there's a work requirement, follow the requirement and you won't lose your coverage. Is there concern among patients who maybe cannot work or are concerned about not being able to meet that requirement? What is the concern there? Can you explain that for us?
Yeah, no, that's a great question, and you actually have some firsthand experience with this in Georgia because you tried a version of work requirements, and one of the things that everybody learned was that it cost the state a ton of money, and a lot of people lost their coverage even though they were working because the administrative process that was set up was very burdensome, which is what has generally been shown to be the case. So I think there are a few different kinds of problems. There are problems where people are working but they're not able to document it sufficiently, either because maybe they work a few different jobs that don't have enough, no one of them has enough hours, but jointly they do, but it's difficult for them to record that in the system or document their work effort. It's not showing up in the payroll system because it could be smaller employers or informal employment or things like that make it hard for people to document their work effort. Or people could have exemptions due to medical conditions but not be able to document those. So you have the problem of people who really are complying with work requirements or are somehow exempt but are unable to document it, so they erroneously lose their coverage. And then there are people who don't comply, but that's because they have a health condition that maybe isn't judged to be significant enough for them to be able to be exempt from the condition, so they lose their coverage. And then of course what happens is it becomes much harder for those people to work because they can't get access to their medications or the health care that they need to be as healthy as they can. So many people project that work requirements could actually result in a reduction of labor force participation because people that lose their coverage find themselves less able to work. So you kind of have the tail wagging the dog where people are supposed to document they're healthy or document that they're working in order to get health care, but really people need to have access to healthcare and be healthy in order to work or to work
Yeah.
as productively as they can. So I think we are going to see a lot of people lose their coverage and then work even less than they did before because they're not able to stay as healthy as they are. So there are a lot of there are a lot of kind of wrong turns that can happen with a program like this.
Yeah, it looks like it could be a cycle that could end up in the negative for some industries. Those who are watching this right now, they might find themselves in the middle of this, a loved one. Any advice for them? Are there any options? What can they do?
Well, I mean, it's a very bad situation, and there's no miraculous solution. I really wish that I weren't talking about this, but I think that what people should do is, wherever they live, wherever their loved one lives, look at what's happening. It's all going to come from the state, so look at their state, look what their state is doing to implement these work requirements, because even though these are federal requirements, they're kind of being implemented in slightly different ways in each state. So, look at what is going to be required for states to see so that people can keep their coverage, and start thinking about it, because we might feel like this is a this is bad policy, and this is, from sort of a values perspective, is a big mistake, and from a pragmatic perspective is a big mistake. But the truth is, this is a policy right now. So for people that are kind of in the midst of it, what they really want to do is not lose their coverage. So I think people should see what the deadlines are, see what they need to do, and take the steps that they can take so that they can keep their coverage. And in most states, the state is sort of reaching out to people, like starting very soon, during the summer, and sort of getting ready to implement this. And it's supposed to go live at the beginning of 2027 in most places.
And that's something that we will certainly be keeping our eye on. Dr. Katherine Hempstead, thank you so much for just taking the time to break down the changes that we are seeing, and the future that could be possible. Well, that will be possible, but we'll see if there are any changes that come about as this, takes place and the reality is hit with so many people across the nation. We truly appreciate you for coming on and sharing that insight.
Sure thing. Anytime. Thanks very much.